Assalamu alaikum dear students. Today we will discuss anatomy most important MCQs. Which layer of the heart is responsible for contraction? Option A epicardium, B pericardium, C myocardium, and option D endocardium. So the correct option is C myocardium. Explanation is the myocardium is the thick middle layer of the heart wall composed of cardiac muscle that pumps blood. Which structure allows communication between the two cerebral hemispheres? Option A corpus callosum, option B hypothalamus, C medulla, and option D pituitary gland. So the correct option is A corpus callosum. The corpus callosum is a thick band of nerve fiber that connects the right and left hemisphere, allowing them to communicate. Subscribe now and press the bell icon. Never miss an update from a technologist. The functional area of the brain responsible for voluntary movement is option A Wernicke's area, B prefrontal cortex, B option C Broca's area, and option D motor cortex. So the correct option is D motor cortex. The motor cortex located in the frontal lobe controls voluntary movement of the skeletal muscles. Which artery is commonly used to measure blood pressure in the arm? Option A ulnar artery, B radial artery, C brachial artery, and option D axillary artery. So the correct option is C brachial artery. Explanation is the brachial artery is the upper arm is the standard site for measuring blood pressure using sphygmomanometer. The first cervical vertebra is called option A axis, B atlas, C odontoid, and option D spinoids. So the correct option is B atlas. The atlas C1 support the skull and allow the head to nod. The axis C2 allow rotation. Which structure separates the right and left cerebral hemisphere? Option A cerebral aqueduct, option B longitudinal fissure, C central sulcus, and option D lateral sulcus. So the correct option is B longitudinal fissure. The longitudinal fissure is a deep groove that divides the brain into the right and left hemisphere. The pituitary gland located in the depression of the sphenoid bone called option A foramen magnum, B optic canal, C sella tertia, and option D cribriform plate. So the correct option is C sella tertia. Sella tertia is saddle-shaped depression in the sphenoid bone that houses the pituitary glands. Which artery supplies oxygenated blood to the heart muscle itself? Option A coronary artery, B pulmonary artery, C brachial artery, and option D subclavian artery. So the correct option is A coronary artery. The coronary arteries arise from the base of the aorta and supply oxygen-rich blood to the myocardium heart muscle. Red blood cells are produced in the option A liver, B yellow bone marrow, C red bone marrow, and option D spleen. So the correct option is C red bone marrow. Red bone marrow found in the flat bone and the end of the long bones is the primary site for hematopoiesis, formation of blood cells. The adult human vertebral column consists of how many vertebrae? Option A 24, B 26, C 33, and option D 30. So the correct option is C 33. In the adult vertebra column has 33 vertebrae, 7 cervical, 12 thoracic, 5 lumbar, 5 fused sacral, and 4 fused coccygeal vertebrae. Which part of the neuron receives incoming signal? Option A, axon, B, dendrites, C, axon hillock, and option D, node of Renwier. So the correct option is B, dendrites. Dendrites are branch extensions that receive signal from the other neurons and transmit them toward the cell body. The appendicular skeleton includes all of the following except option A, pelvic girdle, B, pectoral girdle, C, vertebral column, and option D, upper limbs. So the correct option is C, vertebral column. The vertebral column is a part of axial skeleton. The appendicular skeleton include limbs and girdle. The pancreas is in which abdominal quadrant? Option A, right upper, B, left lower, C, right lower, and option D, left upper. So the correct option is D, left upper. Explanation is the pancreas lies in the upper left quadrant of the abdomen, extending across the posterior abdominal wall. Which of the following bones is classified as an irregular bone? Option A, femur, B, scapula, C, vertebra, and option D, rib. So the correct option is C, vertebra. Explanation is the vertebrae are irregular bone due to the complex shape and structure. They do not fit into the other categories like flat, long, or short bones. Which structure connects muscles to bone? Option A, cartilage, B, ligament, C, tendon, and option D, fascia. So the correct option is C, tendon. Tendons are tough connective tissue that attach muscles to bones, enabling movement. Which layer of the heart lines the inner chamber of the valves? Option A, epicardium, B, myocardium, C, endocardium, and option D, pericardium. So the correct option is C, endocardium. The endocardium is the inner lining of the heart chambers and valves, providing a smooth surface for blood flow. The sinoatrial AC node is in the option A, left ventricle, B, right atrium, C, left atrium, and option D, right ventricle. So the correct option is B, right atrium. The AC node, also called the pacemaker of the heart, is in the right atrium and initiate the heartbeat. The thick filament in a muscle sarcomere is primarily made of option A, actin, B, myosin, C, troponin, and option D, tropomyosin. So the correct option is B, myosin. Myosin form the thick filaments in sarcomere and interacts with the actin during muscle contraction. Which of the following muscles is the chief muscle of respiration? Option A, intercostal muscle, B, diaphragm, C, sternum, and option D, rectus abdominis. So the correct option is B, diaphragm. The diaphragm is the primary muscle involved in the respiration, contracting to expand the thoracic cavity during inhalation. The cell responsible for bone formation is option A, osteocyte, B, osteoclast, option C, chondrocyte, and option D, osteoblast. So the correct option is D, osteoblast. Osteoblasts are bone forming cells that secrete the matrix for bone formation and are essential for bone growth and healing. The largest gland in the human body is option A pancreas, B liver, C thyroid, and option D adrenal. So the correct option is B liver. The liver is the largest internal gland and plays a vital role in metabolism, detoxification, and digestion, bile production. So this is very important MCQs. The main blood supply to the brain is through the dash. Option A jugular vein, B brachial artery, C carotid arteries, and option D subclavian artery. So the correct option is C carotid artery. Explanation is the internal carotid arteries and vertebral arteries supply oxygenated blood to the brain. If you like this video, please subscribe my YouTube channel. अगर आपको मेरी ये वीडियो पसंद है, बराए मेहरबानी मेरे YouTube चैनल को सब्सक्राइब ज़रूर करें. The diaphragm separates which two body cavities? Option A thoracic and pelvic, B thoracic and abdominal, C abdominal and pelvic, and option D cranial and spinal. So the correct option is B thoracic and abdominal. Explanation is the diaphragm is a muscle that separates the thoracic cavity above from the abdominal cavity below. So this is very important MCQs. The number of thoracic vertebra in the human spine is option A 5, B 7, C 12, and option D 8. So the correct option is C 12. Explanation is the human vertebral column has 12 thoracic vertebra that articulate with the ribs. Thank you for watching my videos.